Tick exposure can occur year-round, but ticks are most active during the warmer months, and they could carry a wide variety of tick-borne diseases. Joining us now is Dr. Lauren Ives, family medicine physician with UW Health. Dr. Ives, thank you so much again for coming on to the show.
Of course, glad to be here, Jake.
Yes, absolutely. So starting things off here, Lyme disease is most commonly associated with ticks, but, what are some signs that viewers can really look out for if they think, hey, maybe this is something I have?
Yeah, so deer tick saliva, especially on the nymphs or the young ticks that we're seeing emerge as the weather warms, can transmit an infectious spirochete called Borrelia burgdorferi, along with Ehrlichia or Anaplasma, other infections as well. So early signs and symptoms are the classic target or bullseye rash. This can happen around the bite or sometimes even a different area of the body, along with a flu-like syndrome that can happen. So fevers, chills, malaise for up to a week or longer. Later Lyme's disease can cause other signs and symptoms. So Bell's palsy or nerve palsies, neurologic signs, meningitis, cardiac issues, or in more severe disease, especially in kids, sometimes we see inflammatory joints that come and go in attacks.
Yeah, absolutely. And then, when really should people be making appointments with doctors for something like this? Is there maybe a particular sign that, screams, hey, I should maybe go visit a doctor?
Yeah, so we really see that people don't seek care enough. This is something that we should be seeing more common than what we are. So if you have a deer tick specifically, which is what is being shown now, not a dog tick, but a deer tick bite for longer than 36 hours, you would qualify for antibiotic prophylaxis, so a single dose of antibiotics to try and prevent Lyme's disease for you. And this is true of kids, adults, and even pregnant patients. Certainly, if you're coming back from a camping trip or you're having an unexplained rash or illness ongoing, maybe others are not sick, just you, these are signs that you should seek care.
Yeah, absolutely. And I know that you mentioned sort of that one method of medication that's 36 hours after that deer tick bite. Is that sort of the only Lyme disease treatment available?
So most treatment is with an antibiotic called doxycycline, and you have to be treated within 48 hours of the actual bite, and the tick has to be on for 36 hours to qualify. However, if you have Lyme's disease, you're going to need more treatment. So this can vary from 14 to 21 days, depending on your doctor and the symptoms.
Yeah, absolutely. And then could you give us some tips there for, anybody who's trying to prevent some tick bites later on this spring and this summer?
Absolutely. My passion is prevention. I love to prevent bad things from happening to my patients. So be comfortable with bug spray. You can use 20 to 30% DEET. If you prefer a more natural remedy, I love picaridin. It's like a hot pepper spray. You can find this in your local stores like Farm and Fleet. You can treat your clothes, camping equipment, shoes with permethrin. You can wear light colored long sleeve clothing. And I may look like a nerd, but I tuck my pants into my socks when I'm walking around to prevent cracks from those ticks reaching where they want to go.
Yeah, definitely a good idea on that one. Definitely not something I even thought of there on that one. But hey, Dr. Ives, that is all the time that we have for our interview today. Thank you so much again.